This is inhaled medication administration. First thing, we're going to make sure we have all of our equipment that we need. We do have a medication here that we're going to be given inhaled. Have a nebulizer unit here and a face mask, and then we also have some oxygen tubing. First thing we're doing is take our medication, check our 5 rights, make sure it is the right patient for this medication, make sure it is the right medication that we want to be giving, the right dosage and concentration of the medication, it is the right time to be giving it, and it is via the right route, which is going to be inhaled through a nebulizer system today. We also want to check that medication and make sure that it is clear, there's no particulates in it, and that it is not expired. First thing we're going to do is take our nebulizer unit here, unscrew it, and place our medication inside of that. Alright, we can go ahead and take our mask here and place it onto the nebulizer unit. You can also use the mouthpiece, which the patient actually holds, but the mask a lot of times is easier for you to use. We'll go ahead and set up our oxygen tubing. We'll attach that into the bottom of our nebulizer unit, and then we can attach it into the wall or into our portable log tube, whatever we have available. And then we'll go ahead and set that up on our desired flow rate. Typically you're in the area of 8 liters per minute on a lot of your inhaled medications. That's what you're wanting to set your flow rate at. Of course, we also have our PPE on throughout this whole process. If the patient has a face mask on, some sort of non-rebreather or something like that, we'll go ahead and take it off, and then we'll go ahead and put our nebulizer mask onto the patient here. And we want to be talking to the patient while we're doing all this, letting them know of what this is going to be like, make sure they don't have any allergies, explaining everything to them real well. We want to kind of do that before we give the medication to them, of course. We can go ahead and, as we're doing it, we can be coaching the patient as well to make sure that they do know how to take the medication and how to breathe during this. Instructing them to take nice, deep, full breaths best they can during this whole process. And usually you're taking at least 10 minutes or so to give this medication. So once that's on, we have our flow rate checked and everything. We are getting a good mist in there. You check that before and after you put it on the patient. Make sure that you're getting desired effects from the patient and that there are no adverse effects with our medication that we're giving to them. And then we want to continually reassess that they are getting proper oxygenation. If we need to place something else, some other supportive oxygen on them, we can do that also.